Thank you, Governor, and thank you for your service to our state. You've marshaled a remarkable response to a generational public health challenge. We also appreciate the opportunity to collaborate with you and your team at the Iowa Department of Public Health, the Department of Human Services, Iowa Workforce Development, and Iowa Department of Inspections and Appeals on solutions to protect our state's most vulnerable residents as it relates to this virus. What we know about COVID-19 is that it presents the highest risk of serious illness and death to the elderly and people with pre-existing medical conditions. Our association serves long-term care providers across the state, including nursing facilities, assisted living, and home health agencies, who provide care for Iowa's elderly and most vulnerable residents. We're committed to doing all we can to protect the health and well-being of Iowa's elderly and most vulnerable. As healthcare professionals who care for this population, infection prevention and control are core to what long-term care providers do every day, and they have a number of tools they use to prevent and control infection on a daily basis. In situations where there's a heightened risk like now, one of those tools is to implement visitation protocols and procedures to protect those in our care and to utilize health screening protocols for anyone entering our facilities. Iowa providers have implemented national and state guidance regarding non-essential visits to long-term care facilities and allow entry to only individuals who need entry, restricting activities and visitors with potential for exposure, and actively screen individuals who enter the building. These procedures also require all individuals to wash their hands at entry and for care providers to offer remote communication options for residents and their families to ensure resident safety and quality of life. We understand the challenges these visitation procedures have placed on families. However, it is vitally important that we do everything that we can to protect the health and safety of their loved ones and our residents. In the event of a positive COVID test in a long-term care facility, we are working to ensure our providers have the tools that they need to respond quickly and effectively. Our association has sought waivers on behalf of skilled nursing facilities and home health agencies to temporarily provide flexibility to provide providers to focus on patient care needed during this crisis. The waivers in CMS's current nationwide waivers process has allowed additional flexibilities necessary to take appropriate actions quickly and protect residents and staff, such as moving COVID-19 positive patients into separate wings to receive care. Our association has developed a crisis response toolkit to assist providers with the steps to take if such a situation occurs, including action checklists, employee and patient screening protocols, PPE guidance, and communications tools to help them communicate quickly with the Iowa Department of Public Health, family members, and staff. Providers are in communication with the Iowa Department of Public Health if they have a positive outbreak of COVID-19, as well as communicating with their staff, residents, families, and other agencies. We're also working to keep providers updated as information and guidance evolves and we learn more about COVID-19. We've established a COVID-19 website that's available to the public specifically for long-term care providers that is updated daily, as well as we're hosting weekly provider calls and providing email updates to our members. Protecting the health and well-being of Iowa's long-term care residents and employees remains our top priority. We will continue to work with our members and state and federal health partners to share any new updates as the COVID-19 situation evolves. Thank them for what they're doing and work with them to ensure continued care for Iowa's seniors at this very difficult time. Thank you.